Today I am discussing about mobile or laptop compatible flexible video bronchoscope and how it will change our day-to-day freelancing practice. Difficult airway is the one of the most scary, challenging part of anesthetics, and especially who are working in rural and resource limited setup or in freelancing setup. The difficult airway is the most common cases we encounter in our day-to-day practice, and this is the most leading cause of perioperative morbidity as well as mortality if thing goes wrong. So we all know many kind of cases in our day-to-day by practice we are facing, some case with neck mask, patient with a restricted mouth opening, retarded jaw, a patient with radiation therapy, obese patient, short neck patient, flexion deformity patient, burns patients. So in all that kind of patient, if we'll see or we go ahead with the anesthetic checkup, we directly tell our surgeon that this case intubation might be difficult. So in our setup, there won't be availability of advanced airway gadgets, or I don't know how to intubate such kind of difficult airway cases. So ideally, we should refer this kind of cases to higher center or tertiary care center where bronchoscope facility or any other invasive facility will be available for difficult airway dealing. Our aim for innovating this kind of bronchoscope is such kind of cases, anesthetists should know how to deal with cases. They should adapt the skill to manage such kind of cases with advanced airway gadgets. So, though these kind of cases are difficult for intubation and that are the main challenging cases for airway management, but it's not impossible to deal with such cases nowadays because of availability of advanced skill as well as advanced airway gadgets to deal with such difficult airway cases. Many difficult airway gadgets are available in market, commercially available to deal with such kind of difficult airway cases, starting from flexi-tip laryngoscope to the tracheostomy tube. Today, our main focus is one of the gold standard method to deal with difficult airway, and that is the flexible fiber optic or video bronchoscope guided intubation for difficult airway cases. This image is showing that in majority freelancing practice, we are keeping very safe. Means we are not dealing with such high risk cases or such advanced difficult airway cases because we don't know how to deal with such cases. We don't have a such skill or such advanced airway gadgets to deal with such advanced cases. So if really we want to enjoy the charm of difficult airway, then we should come out of our comfort zone by learning such advanced airway management skill as well as start using such kind of advanced airway gadget like fiber optic bronchoscope or video bronchoscope for such kind of difficult cases. So you will be confident in dealing such kind of cases, and you will surely tell your surgeon that I know how to deal with such cases by using fiber optic bronchoscope or video bronchoscope for advanced airway management. You have to break your boundary if you want to really enjoy your difficult airway cases. Coming to main topic, that flexible bronchoscope. The flexible bronchoscope guided intubation is the one of the gold standard method for the difficult tracheal intubation with success rate of around 98 to 99% cases, and mainly for anticipated difficult airway. If you know already knows that this airway might be difficult for you, then you can prepare airway properly, and with planned or elective fiber optic bronchoscope guided intubation, you can go ahead for such kind of difficult airway cases with almost 99% success rate. What is flexible bronchoscope? So flexible bronchoscope is advanced airway device used for various invasive diagnostic as well as therapeutic procedure of upper and lower respiratory tract, including difficult airway management. In market, there are two variety of commercially available flexible bronchoscope are there. Initially, when flexible bronchoscopy for difficult airway management concept came, that time flexible fiber optic bronchoscope were there in market. But because of so many limitations and so many obstacles with fiber optic bronchoscope, and technology revolution, now flexible fiber optic bronchoscope become obsolete, and now it took place flexible video bronchoscope for difficult airway cases, because there are so many advantages of video bronchoscope compared to the fiber optic bronchoscope for advanced airway management. So today mainly we'll discuss how flexible video bronchoscope will be much superior compared to the flexible bronchoscope for our difficult airway management. First, we'll learn how flexible fiber optic bronchoscope is working and what are the limitations of the flexible bronchoscope, and then we'll go ahead with flexible video bronchoscope. So flexible bronchoscope is advanced airway device composed of thousands of glass fibers, also known as a optical fiber, that carries the light for illumination of image and that also carries the image for airway examination. So in that case, like a small glass fiber will be arranged in a such compact way, and through that glass fiber, image reflection as well as light reflection will be transmitting, and we can see the real image for like airway examination. First, we will come to the component of flexible fiber optic bronchoscope. There are three main components are there for flexible fiber optic bronchoscope. First is the handle, then insertion cord, and then light cable sources. So first we'll talk about handle. We'll start from eyepiece. Eyepiece is mainly for optical viewing of the like view of the fiber optic bronchoscope, and you can attach camera with eyepiece also to see the optical view of image on screen. Then diopter ring. Diopter ring is mainly for focusing of the image, and you can set like a proper image by focusing of lens. Then control lever. Control lever is mainly for tip movement. Like a tip will move in like a upward and downward direction. So through control movement or control lever, you can move tip up, flexible bronchoscope tip up or down. Then working channel. Working channel is mainly for lignocaine or any other local anesthetic drug installation, mainly in case of like sometime if airway anesthesia is not adequate by giving block, then you can locally infiltrate instill lignocaine through working channel. Or else interventional pulmonology, you can insert flexible biopsy forceps through that working channel to take biopsy of like any tumor inside the airway. Then suction button and suction connector. That is mainly for suctioning of the like a blood or secretion. That is also very important because if blood or secretion will be more or it can obscure your vision because of tip will get blood if like secretion or blood will stick on tip. Then coming to the second part of flexible fiber optic bronchoscope, here that light source you have to separately attach the light sources from outside to your bronchoscope, and there your light will be transmitted via glass fiber, means fiber optic bundle only to tip. So here separate units light source by halogen or LED light from outside. Then coming to the insertion cord. Insertion cord is mainly for like long insertions or cord will be there around 55 to 60 centimeter insertion cord, and through that insertion cord that working channel as well as tip bending controlling wire and light bundle and image bundle for fiber optic bundle will travel through insertion cord, and insertion cord is the like a longest part of the fiber optic bronchoscope, and first it will enter through nose into airway. Coming to the what are the optical fibers? These optical fiber are very long thin strand of pure glass fibers about very thin diameter like a human hair, and they are under arranged in a such nice bundle way, and it will be used to transmit the light or image throughout the insertion cord to the eyepiece. So this fiber optic bundle are very sensitive and very delicate bundles in fiber optic bronchoscope. So you need to be very much careful while using fiber optic bronchoscope, or you need to like store properly fiber optic bronchoscope because there are so many concerns about fiber optic bronchoscope. If like a bending or twisting of insertion cord will be there, then chances of like a glass fiber damage will be more. So this all care you need to take up while dealing with fiber optic bronchoscope, like avoid bending, avoid twisting of insertion cord. Then Elwise use bite block in awake or unparalyzed patient to prevent inadvertent biting of the insertion cord of bronchoscope. And Elwise keep insertion cord straight while storing the bronchoscope. So you need special storage box, like long storage box for storage of bronchoscope to keep insertion cord straight. Even fiber optic bronchoscope guided intubation is gold standard method for difficult airway management cases with almost success rate of 98 to 99% cases. But that didn't get much popularity, or it didn't get much penetration among the anesthesia practice for difficult airway management cases. There are so many reasons behind that, and we'll discuss one by one that why this is like a magical device for difficult airway management, but still it couldn't get much popularity or couldn't get much penetration for use of utility of fiber optic bronchoscope for difficult airway management case. There are so many reasons, starting from high cost, because see, fiber optic bronchoscope is like a glass fiber or like an optical fiber will be used for transmission of image or light. So that optical fiber bundle are very costly. due to that cost issue, like fiber optic bronchoscope cost is around 8 to 9 lakh rupees. So it's not affordable in like mainly for developing country like our country. It's not much affordable. So even in our like I did my anesthesia from my Manipal University, there also only one fiber optic bronchoscope were there, and only head of department were using that bronchoscope. Second thing is very easy to damage because that optical fiber are very thin glass fiber. So like twisting or any other bending or any other misuse or rough use can damage glass fiber, and even if like a small fall down also can damage optical fiber, and in such cases that repairing will be very costly. So even if fiber optic will be available in any one setup, it will be limited to their senior professor or senior consultant who are very much used to skill for the fiber optic guided intubation. Then third thing is heavy weight. The fiber optic bronchoscope is like a heavy weighted. Around weight is around like a approximately 800 to 1 kg. So in that cases, like if you continuously hold fiber optic bronchoscope with one hand during intubation, chances of shoulder fatigue will be more. Then poor image resolution, because see that in fiber optic technology, image will get reflected internally and it will be transmitted to glass fiber to optical piece or like a eyepiece. So in that case, image absorption will occur. So ultimately, when it will reach to the eyepieces, the image quality will get blur or will get little poor. In that case, like if you are using fiber optic bronchoscope for like airway examination or any other diagnostic or any therapeutic procedure, then it will be very difficult to view for viewing actual physical characteristic of any pathology inside the airway. Then portability issue. Fiber optic bronchoscope is like a very big setup, like you need separate screen if you are using camera system for viewing, and then like a separate light source also you need to attach, because light also will get transmitted to fiber optic bundle to tip. So in that case, external light source also you need. And main thing is storage of fiber optic also. It's like you need a larger durable case to keep insertion cord straight during storage. So it will be very difficulty to move a fiber optic bronchoscope from one OT setup to another setup, or else we can tell that it's not viable option for use of fiber optic bronchoscope in your freelancing practice or any other like rural or resource limited setup practice, because of there are so many reasons. Now, how to overcome such obstacles that we face with fiber optic bronchoscope? It's like a due to technology revolution. Like initially we know that computer were coming very big, like big CPU, big monitors, keypad, everything. Like uses of computer were limited to office setup only. But nowadays, due to technology upgradation and revolution, now we all know that laptop are very mobile, portable, and cost effective. Laptops are available in market. That same kind of revolution also came in fiber optic technology also. And nowadays, video bronchoscope are available in market, and that made anesthetist job very easy, portable, as well as cost effective to use the video bronchoscope for typical airway management cases. And in that video bronchoscope, there is a use of CMOS or CCD, coupled charge device chip technology. That fiber optic glasses, or that was the most fragile or most delicate part of the bronchoscope, that was replaced by the camera based technology for video bronchoscopy or flexible bronchoscope guided intubation, and it broadened the utility of bronchoscope in rural in resource limited setup. This flexible video bronchoscope is same like fiber optic bronchoscope in functionality as well as physical and mechanical mechanism, right? But main difference is technology difference, that in video bronchoscope, image bundle is replaced with a video camera unit consisting of lens and electronic chip, also known as a CCD or CMOS technology. That CCD or CMOS technology is made up of thousands of microscopic elements, and it's located at distal tip of flexible bronchoscope. And image is produced mainly by many individual sensors, also known as a pixel, that make up image by detecting light level and colors. An external video processor assemble the image, and image is transmitted along the wires to video monitor or screen. Flexible bronchoscope eliminates the need of separate eyepiece also in handle of video bronchoscope. So in that CCD chip technology, there is an array of 33,000 to 1 lakh individual photon cell, also known as a pixel, that will receive photons reflected from the mucosal surface and it will generate the electrons in proportion to light, and it will get transmitted through cable, and ultimately on video screen it will again converted into the video signal. And flexible video bronchoscope also have digital LED at tip of the bronchoscope. So light transmitting fiber optic glasses also that will be replaced by LED, the tip of the bronchoscope. Coming to the advantages of flexible video bronchoscope. So there are so many advantages are there. Also, we can tell that this is the a game changer instrument for difficult airway cases, because there are so many limitations of fiber optic technology that video bronchoscope has overcome, and now it will be accessible, affordable, as well as portable for rural and resource limited setup for use for difficult airway cases. So it's a most economical compared to fiber optic bronchoscope, because this camera chip technology is very cheaper compared to fiber optic glasses. Almost cost of your bronchoscope will reduce from 8 to 9 lakh rupees to the 1 to 2 lakh rupees only. Then less prone to damage, because here that your image will be converted into the electronic signal and it will get transmitted through normal wire. Bending and twisting related issue that will be there with a fiber optic bronchoscope, that won't be there with high flexible video bronchoscope. So that is very less prone for damage and very less maintenance cost required for video bronchoscope. Then it will be very lightweight, because here we are using a wires transmission of images, that glass fiber won't be there. So it will be very much lightweight compared to the flexible fiber optic bronchoscope. Then high resolution. This image and video quality will be much superior compared to the fiber optic bronchoscope, because this is like a video camera based image, and you know that because of advancement in video camera technology, that image resolution will be very high with flexible video bronchoscope compared to the fiber optic bronchoscope. So mainly for diagnostic and therapeutic bronchoscopy, pulmonologist or any intensivist wants to examine the physical characteristic of any tumor or any other airway pathology, then they will properly see mucosal surface or properly see tumor extension or any other if you want, that image quality will be much superior compared to the fiber optic technology. There are so many advantages of flexible video bronchoscope are there compared to the dedicated screen for to see video output of that video bronchoscope. In that cases, you need to pay extra huge cost for to buy screen. So that will be almost 1 to 1.5 lakh is for screen cost. And second thing is, dedicated screen is that maintenance also will be high, because if some fault or some issue will be there, then you have to send it them for service. So dedicated screen maintenance also you need to take care of screen properly. So service related issue also will be there with dedicated screen, and it is also less portable and less user friendly, because it's a big size screen. In freelancing practice, you need to carry screen along with your bronchoscope if you want to use bronchoscope for difficult airway cases. Again, technology revolution came from laptop. Nowadays, tablet or iPad came. So you can use touch screen for rather than extra keypad for laptop. So same kind of revolution. Again, we have modified that bronchoscope with dedicated screen into the mobile or laptop compatible video bronchoscope. So you not need to carry dedicated screen along with bronchoscope. If you have your Android mobile with you, then you can use your mobile by attaching your bronchoscope with screen in such cases. So it will be very much portable. Over a time, technology modification came, and now mobile or laptop compatible video bronchoscope also available to eliminate need of dedicated screen for video bronchoscopy, and it will make this video bronchoscope more economical, portable, as well as user friendly. Our engineering team has developed this mobile or laptop compatible video bronchoscope by doing reverse engineering. They have identified the driver for video bronchoscope camera, and they have converted, they have developed USB decoder processor which will decode the bronchoscope camera signal and convert it into Windows laptop or Android mobile camera based application signal. So we can use our mobile or laptop as a screen of our video bronchoscope. There are so many advantages of mobile compatible video bronchoscope. So because it will eliminate the need of dedicated screen for that. So it has broken monopoly of companies that we have to compulsory buy and use particular screen for video bronchoscopy, and it led to broadening of compatibility of video bronchoscope, and you can use any mobile or laptop for screen of bronchoscope. And it has also become very much cost effective because main cost of video bronchoscope will be the screen of bronchoscope. Because see, the screen costing like a 1 to 1.5 lakh, you will get it like if repeated use, if you want to buy, then it will be in 35 to 40,000 rupees only. Then it is like a screen, you can use mobile or laptop as a screen. So for mobile, it will be like a screen, you no need to carry big screen. So it will be lightweighted or portable if we want to use it in freelancing practice. Then it is more user friendly as you can directly connect with simple mobile and just see video of images, and you can go ahead for bronchoscope guided intubation. Now, what are the applications we need to like get for uses of mobile or laptop as a screen of video bronchoscope? So for Android mobile, we need to download applications through like from Play Store. One is the USB camera app and second is the Camera 5 application. So any of one application you can download through your Play Store in Android mobile, and you can use attach your video bronchoscope with your like a mobile, and you can use your mobile as a screen of video bronchoscope guided intubation. For Windows laptop, there is no need to download any special application for use of video bronchoscope. You can use inbuilt camera application already available in your laptop, and you can use your laptop as a screen of your video bronchoscope. Now coming to the limitations of mobile or laptop compatible video bronchoscope. Our application support will be there with Windows laptop and Android mobile only. So it won't be compatible with iOS system. Coming to the targeted area of application of video bronchoscope. Apart from anesthesia, we all know that for difficult airway dealing, we are using flexible bronchoscope guided intubation. In critical care also, we can use bronchoscope for foreign body pickup or any other like a bronchoalveolar lavage or any other diagnostic or therapeutic airway examination. In surgical oncology also, one can use video bronchoscope mainly to examine the larynx, vocal cord or tracheobronchial tree. ENT specialty to examine nasal cavity, pharynx, larynx or upper airway examination up to pharynx and larynx. They can use for diagnostic as well as therapeutic procedures. In pulmonology, we all know that since long pulmonologists are using Fibreoptic bronchoscope or video bronchoscope for diagnostic and therapeutic bronchoscopy or interventional pulmonology. Video bronchoscope is like magical device, or we can tell that very useful device for many specialty. But in majority of teaching institute, there won't like during PG days we couldn't get enough exposure for video bronchoscopic guided intubation, or we couldn't get any opportunity to how to deal with difficult airway cases with video bronchoscope. So majority consultant in this phase don't know how to give airway blocks or how to prepare airway or how to use video bronchoscope for difficult airway cases. You know that the people are getting scared when someone will tell that like I want to use. If you know your video bronchoscope, then I have video bronchoscope. You can use video bronchoscope for difficult airway cases because they are very much fearful that if bleeding will happen or any other like because of some reason I couldn't get vision, I couldn't secure airway, then patient will suffer. So that case is a lack of training or understanding of for use of bronchoscope is one of the major reason for lesser penetration or lesser popularity of uses of video bronchoscope for difficult airway cases. And second thing is cost of device. See, now because of video bronchoscope and again mobile or laptop compatible video bronchoscope has came down cost of video bronchoscope almost one tenth compared to the previous fiber optic technology or any other higher end gadgets for airway. But still in rural setup or any other like a resource limited setup, pain capacity is main issue for patients. So cost of device also one of the factor that because of that video bronchoscope still didn't get penetration for use like a frequent uses in such difficult airway cases. Now I am showing flexible video bronchoscope guided intubation, and in this case I am using my own mobile as a screen of video bronchoscope. You can see that I can nicely see image of larynx, vocal cord in my mobile by attaching my video bronchoscope with mobile, and you can see that same black fiber optic bronchoscope. You can use this video bronchoscope for difficult airway cases. This is the case of CA buccal mucosa with restricted mouth opening. That mouth opening was almost less than one finger breadth. So we could that was one of the case of anticipated difficult airway, and we have used our mobile or laptop compatible video bronchoscope to secure airway in this case. You can see nicely tracheal ring also. See, you can see image clarity as superior as dedicated screen with mobile also. So it will be very much feasible to use mobile as a screen of your video bronchoscope in your freelancing practice. You can nicely see carina also. You can nicely see how much clear vision is coming. You can nicely see mucosal surface, small capillaries, and vocal cord, tracheal ring. So this image and videos is recorded through my own mobile, because in mobile application also you can record the videos or you can capture the image if you want to use it for learning purpose or any other teaching purpose. See, you can nicely see tracheal rings. Mobile compatible video bronchoscope, we have presented this our innovative bronchoscope in one of the conference on research and innovation in anesthesia and critical care at Jhansi just 1 month back. And that conference we have presented our this presentation also. And I have won second prize in for our innovation for difficult airway cases. Now, to overcome challenges of like we all know that we don't know how to use bronchoscope for difficult airway cases, so we have started our own academic skill development workshop to be like to teach our colleague to how to be familiar and how to use the video bronchoscope for difficult airway cases. So recently we have conducted one difficult airway workshop in Delhi, and we are running one organization, that is Global Anesthesia Skill Development Association, and under that roof we are conducting such kind of airway workshop to train doctors for usage of video bronchoscope. This is our core R&D team, that is consist of biomedical engineer, electronic engineer, software engineer, and anesthetist. And we are working is like a team, and we are innovating devices which will be like more user friendly, cost effective, as well as like a portable. So the devices will get maximum penetration in rural and resource limited setup. And any anesthetist working in like a resource limited setup also can use such advanced airway devices for such kind of difficult cases. As of now, we have two innovated devices already in market. First is the peripheral nerve stimulator. Since 3 years that our PNS is in the market, and we are working mainly with mission that maximum number of anesthetists start using PNS rather than using blind technique for block. So this PNS, we have developed mobile size PNS device for regional anesthesia, and around more than 2000 installations are there across the India in our PNS device. And this is second innovation is there, that is mobile or laptop compatible video bronchoscope.